Hello, my name is Dr. Dick Zoutman. I'm a medical microbiologist and an infectious disease specialist here in Kingston. I'm working with the Hospital-Acquired Infections Group, part of the Clinical Services Roadmap Initiative here in the Southeast LHIN. We're looking at making some significant improvements to how we prevent infections that occur in the healthcare setting. And we're not just looking at the hospital environment, but also the continuum of care. Long-term care, complex continuing care, and mental health are all part of a system where infections can be transmitted. The key issues that we hope to address are hand hygiene, which is so basic. We're also looking at standardizing infection control practices to maximize prevention, particularly how we use critical information through a brand new and very exciting regional infection control information system. And finally, we're taking a critical look at antibiotics. So what are we planning on doing then? Well, with hand hygiene, it's so important that we want to make sure that we make it very clear to everyone what the expectation is and what the best practice is around hand hygiene throughout the entire continuum of care. Hand hygiene is basic, and we want to make sure that everybody has a good understanding of how to do hand hygiene, when to do hand hygiene, and to realize how very important it is to preventing transmission when we're delivering care. The other area is around the Regional Infection Control Information System that we call RICS. This brand new and very exciting initiative will allow the infection control professionals in southeastern Ontario to track cases of infection, to know where the cases are as they transfer through the continuing care environment here. For example, if you come from the community and the hospital is alerted a patient has an infection in the new RIC system, they'll have that information before the patient arrives, say for an operation. As well, when they are transferred to rehabilitation therapy or back to the community, all of that information will be available, allowing us to do a better job. And finally, we're looking at antibiotics. Antibiotics have been around for a long time, but the bacteria are becoming more resistant. So our goal is to look at antibiotic use very critically and reduce unnecessary antibiotic use where it's not helping and making bacteria more resistant, and optimizing antibiotic use where it really makes a difference. We're very excited about this opportunity as well. We really want your input. So while you're viewing this video, we hope that you'll enter into the workbook area of the Clinical Services Roadmap webpage to take a look at your opportunities to give feedback, because we really know that your input is so important for us to get this right. So we hope that our initiatives will be helpful in reducing infections throughout the healthcare system.